Have you ever had this little bump on your eyelids that keeps swelling? You thought it is not painful, not reddish, but it's still there, doesn't want to go away? It is called a Chalazion, and in this video, I'm going to take you step by step on how you can simply treat it at home. Let's get started. Hi, my name is Dr. Harun. I make videos to help you care for your eyes and protect your vision for life. So if this is your first time coming, feel free to subscribe so that you don't miss out to future videos that may help protect your eyes. In order for you to better understand how we can simply treat it at home, you need to know what is it and what causes it. A Chalazion basically happens because there are some structures on your upper and lower eyelids that produce oil to prevent the surface of your eyes from getting dry easily. So if the opening filled to this oil comes out of get blocked, this oil keeps accumulating at one place and continues swelling like that, giving rise to what is known as a Chalazion. Don't get confused. This Chalazion is different from a style to that like this, where the swelling is all over the eyelid margin, not at one place, which is painful and is usually caused by an infection. A Chalazion is not painful and is not usually caused by an infection. So now, how can you treat it at home? The treatment is simple. It is called warm compresses. How to do it? Here are the steps. Step 1. Wash your hands with soap and water. Step 2. Get a clean handkerchief and soak it in a warm water. Note that the water should not be too warm because it can burn the skin around your eyelids, which is very thin, and it can be painful. Step 3. Apply it around the area of the Chalazion and keep it in place for a few seconds. Continue like that for about 10 to 15 minutes and do it 3 to 4 times a day. Step 4. Each time you do that, clean your hands again and put your finger on the Chalazion and be pressing it. Not too hard or trying to push it out yourself. Just gently like a massage. That will help the oil melt and find its way out easy. If you do that for at least 1 minute, I assure you that it will go away. Because it happens to many people, and when they ask me, the best thing I ask them to do at home is do these warm compresses. At the most, I can add maybe topical antibiotics like tobramycin to prevent secondary infection, but these warm compresses can also be very, very effective. And you get a faster result if the Chalazion does not stay on your eye for longer, like for more than months or years. But if it already stays for months or years and you tried all this procedure for several weeks and it doesn't go away, then you need to see your local eye doctor. Because it has reached a stage where these warm compresses alone cannot be able to treat it. So you need to go to your local eye clinic where they can use either steroid injection to reduce the inflammation or remove it completely. It's your surgical procedure called curettage. So don't take it as a big eye surgery. It's done within few minutes and you go back from instant. Only that your eyes will depart and they'll give you pain relievers and antibiotics to have a relief and prevent any kind of infection that may arise after the procedure. So that is it. Thank you so much for watching and I hope that helps. Don't forget to like this video, and if this is your first time coming, feel free to subscribe to it and also that you don't miss out our future videos. And if you want to test your eyes right now at home to see how well your eyes are working, I made a video about that. You can check it